This is Dr. Manisha. I'm working as a medical lead in Lupin Medical Affairs Division. I welcome you, extend a warm welcome to all of you in this brief discussion on patient awareness program for patients of PCOD and mental health diseases. Today, joining with me is very renowned psychiatrist, Dr. Rachna Gupta. She's there with us to take us through this session. Welcome, Dr. Rachna.
Good morning, Manisha, and thank you for giving me a chance for this awareness program. Good morning, everyone sitting with us. Today, I really want to focus on the mental health awareness so that after this session, I'll be a little helpful to you all for managing the mental health of every individual.
Thank you, ma'am.
Okay.
So as we all, thank you for setting the context. Here we are to discuss the PCOS and mental health disease. We all aware that basically the polycystic ovarian disease is a complex disorder that affects not only the patient's various aspects of physical health, but also emotional aspect as well. So we all aware also that mental health illness is very common in these women affected with PCOS. So we would like to take opinion from our expert today, Dr. Rachna, that is it true PCOD affects the mental health, and if how it happens?
Okay. Sure. First, Dr. Manisha, I would like to focus a few points on PCOD so that at least we are aware of what is exactly PCOD is. It is
Right.
a endocrinopathy. It is seen in women of reproductive age between 15 to 45 or 40 years of age. And in this, basically, what happens is there is an hormonal imbalances. So what we see is hyperinsulinemia, hyperandrogenemia, and because of this insulin resistance, we see different endocrino disorders like diabetes mellitus, hyperlipidemia, cardiac diseases are because of that. And hyperandrogenemia means like it's a male hormone which increases mostly. And the ovary, there are many cysts in the ovaries which leads to hyper production of more and more of hormones, and which shows the symptoms like acne. More of acne are seen, more hirsutism, like more hair growth. And there is one more thing, there is anovulation. Anovulation means there is no or less production of ovum. So the main problem with the female during the reproductive age group, we see that there is infertility which is addressed by most of the females at that reproductive age group. They only come to us or they only come to the gynecologist because they are not getting pregnant. Otherwise they are not even bothered about all of those things. With they are putting on weight, hirsutism, everything they are just ignoring. But when the problem comes to infertility, I have noticed that this is the main reason they come to the gynecologist, or some then they are diagnosed with PCOD. Or the second thing is amenorrhea, like there are menstrual disturbances. So these are the two things which we can focus on, so that early detection of PCOD is very important. Now, the prevalence of PCOD in among population is 5 to 10%. And the second thing is what is the problem and how does PCOD, like the main thing what we need to understand, why PCOD is causing mental health issues. Now, we know that there is one HPA axis. HPA is hypopituitary adrenal axis, which is leading to more and more of increase in cortisol levels and these things, which leads to more mental health problems. What and the people with PCOD, we have seen that 3% there is an increase of mental health issues more in PCODs, like 3% increase. So what we see mostly in mental health is, first I need to really focus what is mental health and when we call it as a disorder. See, we need to first understand what is normality and what is abnormality. If we are not aware of these things, we usually think that everyone is suffering. In casual life also we see that I am having anxiety, I am having depression, I am having this problem. It is not like that. When we call it as a disorder, when we are productivity, like in social, occupation, and our personal lives. Our all the three fields are getting affected. We call it it as a disorder. And before that, we think that everything is normalized. At least everyone has a coping skills. So we call it as disorder only when these things are like personal lives are affecting, like occupation is affecting, performance is decreasing, we are not able to achieve the task, communities more and more of angers, there are disturbances in relationships. So these are the things when we call it as a disorder. Now what we see in PCODs is related to the mental health issues. First is depression, anxieties, eating disorders are also mostly seen in that. And one is the sexual and the relationships functioning is affected, and one is eating disorder, like OCDs and OCDs also. These are the main issues we encounter in PCODs. Now what is making, yes, Dr. Manisha?
Yes, please continue, ma'am. Please continue.
Yes. Now what is making these mental disorders, like what is making these abnormalities, especially in PCODs? It's because of the negative mental health status, like more of amenorrhea, infertilities, body image. The females of the reproductive age, again, they are worried about their body image, like more and more of hair growth and acne, looks. All these things creates a negative image, which is, this is negative thinking. This is again a cognitive distortion. Now the second thing is high emotional regulation and self efficacy. Means if we have good emotional regulation and self efficacy is good, we have less stress. If our efficacy is less and emotional regulation, I'll later on focus on this also. But right now, if our emotional regulation is poor, we cannot manage our stress. And most important is expressing our emotions, family support, family social network reaction. All these things are also important. And not last but not least, women should be aware of what is PCODs. They should have at least a knowledge about what is PCOD and how they can manage with their hyperinsulinic state and hyperandrogen state. Actually, if they are aware of all these things, they can actually work. Because I will also focus specifically on this, because there are certain exercises, there are certain diets which can help them to improve these states. So what are the signs and symptoms, Dr. Manisha? I mean, like, these are the points everyone wants to know. What are the signs and symptoms we encounter, and what are the we find in patients? What makes us diagnose as anxiety, depression, or these kinds of things? So in anxiety or in anxiety, there are we divide in psychological symptoms, emotional symptoms, and what are we see in behavioral. What are psychological symptoms? uh, there are difficulty in concentration. The people are not able to concentrate and focus or complete the task. Means like they are not able to attend or sustain the attention for few minutes, so they are not able to complete the task. Lack of interest. uh, they become See, what happens is, now I am very happy in watching movies, I'm enjoying it, I'm enjoying my work. But what happened when I'm distressed, I am stressful, I'm not able to enjoy what is pleasurable for me in previous days. So I'm not able to enjoy these pleasurable activities right now. So this is called as lack of interest in pleasurable activities. And which makes now my looks is making me poor self confidence. My confidence is decreasing because of my performance levels. Low self esteem because of my looks. This is bothering. This is specifically I am focusing on PCODs, but in general also we see low self esteem, low concentration, uh, low difficulty, self confidence, low self confidence. Now these are the things which contributes more and more. Like it increases our worry. Now it becomes a vicious cycle. I worry more of the times about all these things. So to decrease this worry, what we do is uh, we stop avoiding situation. We start avoiding situation. Like for example, I do not want, if I am anxious about going to a, for example, in COVID times, I was anxious to go to a hospital. Even I'm hypertensive, I will never reach to that, but I need a support, I will never reach. And the people are dying, but this is kind of avoidance behavior is coming in me. It is again, this now we have develop an abnormal thing, that is avoiding the situations. Emotional, what is emotional? Now what we see is anger. More of, I am getting irritable in small issues, which is not even provocable. I mean, like non unprovocable. Also, I am getting irritated for small issues. I'm not able to displace things, or I'm not able to. I'm displacing things. Means for small angers, I'm shouting at my children's, or these kinds of things. More and more, I am indulging in more and more fights. I am getting fear and more worry. As I told you, more and more worry is increasing. I am becoming isolated. I am not able to communicate with the people. I am staying all alone. Loneliness. Now I am becoming helpless. I am not getting help, and I nobody is going to help me. I have of no use. I am of no use to others. This is worthless, helpless, hopeless. I will not be able to do. Helpless, hopeless, and worthlessness. These are things are developing in me. So again, it's a vicious cycle. This creates a societal ideations, which is a warning sign. Helpless, hopeless, worthlessness. When the person is thinking these kind of things, they really need a help. So it is very, if it is early, if we detect, so it is better to prevent suicide. Now, behavioral, what we see in behavioral, decrease in support system, decrease in our effort, sorry. So our effort also decreases. If we are not able to concentrate, if we are not able to complete our task, and if we are not efficiently work, if we are not able to work efficiently, means we are not giving our 100% to complete the task. And declining, obviously we are going to decline in our performance, avoiding peoples, avoiding the situations, avoiding the situations, or avoiding focusing. So these again create the stress. These are the signs we see, Dr. Manisha. As I told you, I would like to focus on these things. So I hope the people are little bit aware of what are the signs and symptoms. Am I able to communicate, Manisha?
Yes, yes. Yes, ma'am. Very well said and very rightly pointed out also that this is basically a holistic disease approach is required for this kind of, it is not just PCOD, but it overall that patient work efficiency and productivity is also overall decreased
Yes,
in
definitely.
such kind of patients. And it is quite serious. It is actually serious about the original disease disorder.
Yes,
So
definitely.
thank you very much for giving this information. So, I would also like to ask you about the management part. So,
Definitely.
how generally we manage? Is there any management available, and how we can give hope to the patients regarding such kind of condition?
Yes, Dr. Manisha. Now, how we divide management of stress? It is divided in four or five basically tools. Like one is physical, second is psychological, third is emotional, spiritual, and social. This is how we manage the stress or the disorders in these various areas. So in physical things, what we do is we will focus mainly on the nutritious food, exercises, and the sleep pattern, the sleep hygiene, and all these things. So we mainly focus on all these things. So in physical thing, specifically, I would like to focus for this PCODs. I have find out few kind of exercises specifically, because there is a state of hyperinsulinic states and hyperandrogenemia. which will help to these kind of exercises will help to decrease the insulin's resistance, and definitely the LH surge and FSH, whatever has been increased, which will also be helpful. These kind of exercises, and food also. So the food which we should specifically avoid is the saturated fats, like ghee, butter, fried foods, red meat, and processed snacks like cake, cookies, prepared cereals, sugary beverages, white rice, and the refined flour, which is called as maida. So all these things, and the beverages or the foods which has high content of sugar, especially the fructose in it. So we should avoid those kind of foods in PCOS, or in general also we should avoid it. And what food we should consume is omega 3 rich foods, like we can see in vegetarians, that we can see high in apricots, like walnuts and apricots, salmon, fish, which should be baked. And fish is also a rich source of omega 3 fatty acids. And beans and other proteins, legumes, these kinds of things, starchy. What we should avoid more is starchy foods, like potatoes. All these foods are not to be consumed in more amount. Like nominal is okay, but not to be consumed in more amount. Green leafy vegetables, tomatoes, mushrooms, whole grains, we all know these. In dessert, what we should do is high fruits is the best source. Like if you want a sugar, instead of sugar, we can use dates. Instead of sugary things, we can use jaggery more. So these kinds of things are helpful to reduce the fructose or the high increment of sugar levels in the blood. So I think this kind of food is good for maintaining the health, because there is obesity, which is really difficult for people with PCODs to reduce. So higher hyperglycemic stage food or higher glycemic index foods are to be avoided by the PCODs people. Now the exercises, they have focused mainly. I have found out few exercises from the good references. So exercises, what is help in reduce improving your sleep pattern, mood, hormone, balancing your hormones, everything is very so I like to really go to directly to the kind of exercises. Now first is the cardiovascular steady state exercise. Means steady state exercise means, in this what you need to do is more of cardiac activities like treadmill walking, the anaerobics, dancing, bicycling, walking, so that in that what you do is more of heart rate is increased. But it's always, it has to be done under the some trainer or something like that sort of. So one specifically which has been focused in every references which I found is high intensity interval training. This is very good type of exercise which has good for PCODs people. This what is in this is this consists of short burst of high workouts, and then there is an interval of break or a stop of 1 minute. So this is called as high intensity interval training. So in high intensity, what you do is extremely intenseful. Like again, I said brisk walking, or the on the treadmill walk. You walk fast on the treadmill, and there is increase in heart rate, and then you take a 1 minute break. So what why and how it is this type of exercise is helpful, because it engages in post exercise, where when there is a break period, what happen is in this time more oxygen is required by the cells, and how the oxygen is going to travel by the glucose. So it helps in reducing or burning your fat. So these kind of exercises are very helpful in specifically in PCOD people, high intensity interval training. But definitely, I will suggest it should be done under a trainer or a wherever people are going. Now, what other exercises are mind and body exercises, like yogas, meditations, and these are the body, mind and body exercises for increasing your attentions. And one is strengthening exercises. Now your obesity is, if it is decreasing, your muscles has to be toned so that it is not lax. So for that, uh, they are focusing on the strengthening exercises. So these kind of the exercises I found on various references, which has been focused for PCOD people. In general, also we say what happened specifically. We don't do exercises. Basically, whenever the client is coming to me, I don't focus saying that exercises only is for reducing weight. Exercises is not only for reducing weight. It release endorphins from your body when you do exercise. These hormones are positive hormones. These hormones work in positive thinking, positive thinking of your situations. So it is very important to give certain times or certain time to yourself, so that everyone should exercise for few minutes of your day. Second, I would like to focus on this also for females. Time scheduling your priorities, scheduling your time management, matlab how to manage your time accordingly, so that you are have and time for yourself. And even setting your priorities will help in scheduling your times and decreasing the stressful burden on you. So this will be helpful for dealing with many of your work, or increasing your efficiencies. Now what we do in psychological thing is a positive self talk, motivating oneself. How you do is control yourself, control your negative emotions. By how you do is compassionate statements, uh, forwarding compassionate statement, like whenever you think negative, say to your mind, completely say and think positively, think that definitely it is going to work, let me try. Commitment, give commitment, I will do in that time. Challenge yourself, if I'll not do, what will happen? Control, commitment, and challenge. So these are the psychological things we do. How we do is again I said, managing time effectively, planning things, reducing the priorities, prioritizing your things. So these are the things. Emotionally, don't suppress. How we say, don't suppress your feeling, express your emotions. Say that I am not feeling well. uh, Say to what whoever is close to you or who understands you. Ventilation of your thoughts is very, 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 very important. Even if you want to cry, you should cry, but ventilating your thoughts is very important to your near dear friends, mother, father, everywhere, whenever, wherever you get time, you should ventilate your thoughts, which makes you feel better. Spirituality, again I said, meditations, prayers, and everything. So social, like support system, because in specifically in this, what is the problem is infertility. Infertility is an issue which is making family, and if the family is not supportive, it is increasing the stress burden. And obviously the family social network reaction is also the one of the reasons for the inducing stress. And if you get time, explore your hobbies. Um, Give time to yourself, explore your hobbies, do listen to music, drawing, paintings, whatever is your hobby. Laughter therapy, practice laughter therapy, mindfulness. So give certain time to all these things, it definitely going to work for you. Anything
Yes.
else you would like to ask
Yeah,
me?
yeah, yeah. Ma'am, thank you very much for giving this elaborative and very nice, information to us. This is really very valuable, and I feel like this is the message which viewers are also required, that yes, these are very, looks like very routine life activities, but these are very important in one's life to keep all these disorders away from us, as well as keeping the mental health, kind of well-being, maintaining our well-being in terms of mental health. So thank you very much. We are reaching at the end of this session. I would like to, before going, wrapping this session, I would like to give you a thank you note for this. And thank you so much for coming here and sharing these views and opinion. This is our, viewers are going to definitely help from this conversation, and they will benefit out of this dialogue. Thank you very much, ma'am.
Thank you, Dr. Manisha. Thank you so much.
Thank you.